Hi, Dr. Rob Silverman here, Facebook Live. Got a great topic today. We jumped right in. Thank you, Joanne, for a great cue. We want to talk about the idea of, does injury essentially equate to pain? And are all these tests that so many patients ask for, and a lot of doctors prescribe, like MRIs and x-rays, with all these findings, what do they mean? What's the percentage of patients who get them? How to treat them? And what does it all mean for you out there? Because it's all about you. So please do me a favor. This is very interesting. These are great numbers. Like, click, and share. Please share it. And if you have any questions, Joanne's right there. She's ready to answer any questions or anything as we go through this. So number one, let's talk about one of the more common injuries that we see in a chiropractic manual therapist, even in an orthopedist office. That's shoulder. 50% of people who reach the age of 60 have what we call an asymptomatic rotator cuff. So at least 5 out of 10 people will have a rotator cuff tear on a scan without any pain. So what is a rotator cuff? So we got our handy dandy little model here. Rotator cuff is 4 muscles, 6 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. They provide stability to the humerus right over here. They allow you not to get a shoulder impingement, and they allow you to externally rotate and move the shoulder. So any one of these muscles, when injured, allows you to get an impingement, and any one of the injuries to any one of those muscles is a rotator cuff. A very, very common injury, by the fact that 50% of people that reach the age of 60 do not have pain yet have a rotator cuff tear. In addition, when they cadavered women, 8 out of 10 women had torn rotator cuffs at the time of death. So you're going to see a lot of injuries in rotator cuff. We're going to talk about how to treat it a little bit more. So once again, when you come in and say, my shoulder hurts, does that MRI, does that x-ray, what does that give? Sure, it's something that's needed, especially if there's trauma. It rules out, some systemic things like cancer and things of that nature, fracture. But what it truly tells you is that sometimes something's a complicating factor, but it's not the reason for the pain. Just remember that. There's certain things that are complicating factors, but not the reason you have your pain, because if more than half of America can walk around with an asymptomatic rotator cuff, it's not injury to pain. In addition, let's look at a disc bulge. 87% of all people between the ages of 20 and 70, it's almost 9 out of 10, have a cervical disc bulge. 8 out of 10 Americans have lower back pain. Their lower back pain, which we have right here, is under 30. 4 to 10 people have a disc degeneration, and over 50, in my age bracket, 9 out of 10. So what is a disc bulge? So here's our model, and I'm going to just, don't look at that guy. Here's the normal. Here's a beautiful nucleus, perfectly in place. These concentric rings around it are an annulus. The outer third of the annulus is the only part for nerve or nerve roots. So that's part of the reason that people can have what we call a disc bulge here and yet no pain, because it has to tear the nucleus into the outer third. Anybody, my chiros and my physical therapists, tell me the nerve that innervates the outer third of the disc. I want to see who can get that right. Nevertheless, here's the bulge, and you see a slight bulging out. So if it's bulging out in this manner, it's never going to go into that outer third of the annulus, hence the idea of no pain. This happens to be a lumbar spine model. Here is your herniated disc. Your herniated disc is where you have more tearing. It's still attached. That didn't come in these numbers, but nevertheless, an additional number is 1/3 of Americans have a herniated disc without discomfort. So once again, there's that MRI. My back hurts, my neck hurts. You have a herniated disc. Is that generating the pain? It may not be. It's a complicating factor. Is there pressure from the disc on the nerve? Probably not. It's leaking. So these are chemical irritants. When these leak and these come out and expose, these being the nuclear material, and it's exposed like in a bad herniation, it typically leaks on a nerve. Leaking on a nerve causes inflammation, and the body's response to inflammation is autoimmunity. So let's look at the knee. 85% of adults have knee arthritis that does not cause pain. So most people, when they come in my office and complain about knee pain, have arthritis. Arthritis is your body's response to inflammation. Giving me a look. Did somebody say hello or something? Did I need to respond? Okay. 85% of adults have knee arthritis that does not cause pain. Once again, it's your body's response to inflammation. Interestingly enough, here's your knee, and you've got all these different structures in the knee, so it's a meniscus. The jury's out. They talk about surgeries now and knee surgeries, and guess what they found? They found that knee surgeries for a torn meniscus are not effective because they have in 6 months the same amount of incidence of arthritis, but whether you have surgery or whether you don't have surgery. So conservative care is fabulous when it comes to a knee injury. Just remember, almost everybody has some form of knee osteoarthritis. Then we've got the hip, and here's our little hip over here and our big guy. And the hip, we've got what we call a cam deformity. So the hip is deformed 37%. We have a pincer deformity. Pincer means that the hip is grabbing and pincing like a pin. And finally, a labral injury. 68% of people have a labral injury. Last 5 years, so many people, I got you, Joe, so many people have had these labrums. What you got?
So you have someone from London, Marita.
Marita, how are you from London? There are vitamins there, not vitamins.
Nancy says hello.
Hey, Nancy, how are you? Where's Nancy? Did she say where she's from?
She didn't.
You guys got to tell us where you're from. You know, we want to feel like we're getting, 80 days around the world when we do these Facebook Lives.
And Mercedes. She uses the handy.
Mercedes, hola, right? So we got some hellos. So that's fabulous. So here's the hip once again. We got a cam deformity, damage in the hip joint. Pincer, once again, it's like pinning and grabbing the hip. When you lift your hip, it really hurts. And a labral tear. Labral tears in hips are so common in sports. They just became common real 5 or 6 different years ago. So with all that being said, what happened to all those people before the labral tear? Labral tears, really tough to really have great outcome post-surgery. Some great doctors in New York at the hospital special surgery who do that. Did you have something else to tell me? I see you waving at me.
Nancy's from Texas, Baytown.
Hey, Texas, Baytown. I was just out in Dallas 2 weeks ago lecturing.
And then Marita says she's going to share to Joe and Zoe.
Great. Share this great information, because I think the takeaway is there's so many injuries, and we have so many injuries that you find out once you take a diagnostic test that don't necessarily correlate to pain. Speaking of that, I just had a patient come in last week and they had a lot of left-sided back pain. So we took an MRI. Within that MRI, we found out they had horrible damage to the right side. Now, there was no way there was a correlation between the pain and injury. So understand MRI and x-rays have their place and they're needed, and you don't want a doctor not to take it. But don't think that if you take it, that is the end-all, be-all. Finally, let's talk about the ankle, the sprained ankle. And actually, I didn't bring the ankle, I brought the foot in. So the ankle right over here, you got the anterior talofibular ligament, and in that ankle, it's almost like 80% of people have some damage. Everybody has inverted and damaged their ankle. So many people have that very common ligament, the anterior talofibular ligament, that are injured, that you'll find in an x-ray and an MRI. So everybody has an ankle sprain. It's the most recurrent injury in sports. We have to learn or share some takeaways. One of the biggest takeaways would be to do a lot of proprioception with that. Heel spurs at the bottom. Well, that's more like at the bottom of the foot. So that's right in here. Heel spurs. Almost 1/3 of Americans have heel spurs with no pain. Most people think a heel spur causes plantar fasciitis. It's typically not. The plantar fascia is not this. This is the plantar aponeurosis. The plantar fascia is over here. 70% or more of plantar fasciitis is actually what we would call here through the tarsal tunnel, and it's neurogenic. So neurogenic would mean that it's the nerve in the tarsal tunnel, about 50%, and then there's a little lateral nerve here, the lateral plantar nerve, and that lateral plantar nerve is something called Baxter's neuropathy, and Baxter's neuropathy is about 20% at a time. So it's really not the spur that causes the plantar fasciitis, it's more the impingement of the nerve. Big takeaway here is low-level laser. The Erconia laser has an FDA clearance, 6 visits for plantar fasciitis, where people have failed in other treatments, multiple other treatments. Big takeaway in that. I seem to have covered everything. Martin's neuroma is a nerve in the bottom of the foot that's 54% asymmetrical. So when people feel it, they usually feel it years and years after. It usually doesn't correlate to when you get it to when you feel the pain. Did you have something else, or do we have some questions that were popping up?
No, we have no questions right now. We do have a couple of questions.
Go ahead.
First question. What are the best out of office and in-office tests to determine positive outcomes for my condition?
So the best in-office and out-of-office tests for positive conditions or to help you really diagnose is obviously MRI and X-ray are very good when needed with trauma over a duration of time to rule out systemic or structural faults. So there you're out of office. There's also a CAT scan. So you want to go to a doctor who's able to prescribe for that. As a chiropractor, we're able to prescribe for that. In office, what I found to be most effective in office is any kind of functional movement, orthopedic, neurological tests. So we give a full evaluation here of different joints and the whole body to ensure that we have a good idea, because I like to treat the patient. I don't necessarily like to treat the diagnostic test.
What are the best treatment options for various conditions?
Okay, the best treatments options that I found in this office for these musculoskeletal conditions, these are all musculoskeletal conditions, are, chiropractic manipulation has worked great. Soft tissue work, we've got our active release. We've got a big shout out once again to our factor guys, instrument assisted soft tissue mobilization. Laser, Marconi laser, we have a plethora of lasers that we use here that I found to be extraordinarily effective, not only for nerve impingements, but for musculoskeletal. We're doing an FDA clearance here on one of the lasers. We're getting some great outcomes. Really excited about to have that published. Exercise rehab has shown to be outstanding. Great exercise rehab sources of web exercises in Chiro Up. Actually, this was an idea from something that Chiro Up put up on Sunday. Big shout out to my guys Brandon and Tim. They do a great job.
Does functional medicine and lifestyle play a role in these conditions?
Absolutely. Does functional medicine and lifestyle play a role in these conditions? Absolutely. Food is information. Food, bad food, is a potentiator for inflammation. Gut health, which you hear me talk about every week, gut health is a critical element. So functional medicine is getting to the system. So a tie-in to the musculoskeletal system, without question, is the gastrointestinal system. So functional medicine correlates those two. My book, Inside Out Health, is a great choice. Anybody want more information on gut health and musculoskeletal? I'm very happy to talk about that some more. When you have a compromised gut health, you're releasing toxins, you're stimulating something called cytokines, you're stimulating NF-kappa B, which is the signal transducer of inflammation, which leads to musculoskeletal faults. Lifestyle is critical. Movement, posture. Big shout out to my man Steve Weiniger at Posture, does a great job. Without question, all these things correlate because everything goes into this stew, as my wife likes to say.
And lastly, can one condition cause another?
Yes, can one condition cause another? Without question. Inflammation is throughout the body. It's not just local. The body's all interconnected. So without question, one condition can lead to another. Plus, you're put together by interconnecting joints. So if you have damage to the shoulder and your shoulder doesn't move, your elbow's not going to move well. Therefore, you're going to strain your elbow. Great example is most people have flexibility issues in their shoulder, damage their elbow with lateral or medial epicondylitis. Do we have any other shout outs or anything that I need to do?
We have Yoli Elias. Hello there.
Hello, Yoli. How are you today? Are we good?
We're good. We are good.
Outstanding. So the real takeaway here is there's so many conditions, and what you're seeing is your injury doesn't necessarily correlate to your pain. That injury could be a complicating factor, not necessarily the inciting factor for pain. Please go to somebody who's going to take diagnostic tests, use them appropriately, in-office tests, correlate them, and treat you. We are going to be starting a big webcast at the beginning of July. Stephanie's in charge of that. We got some big names. You guys are going to love it. It's called Proven Health Alternatives. It is going to be on Thursday in the early afternoon. We'll have some announcements. And if you have anybody that you want to see in our Proven Health Alternatives, put their name down there. See you next Tuesday. Dr. Rob, always yours in health.